Is the fertility cliff a real thing? In other words, when the clock strikes midnight and you're on the eve of your 35th birthday, you go from 34 to 35, do all of your eggs magically disintegrate or turn bad?
I'm a fertility doctor and the author of The Lucky Egg, where I delve deep into the female biological clock. Here's what you need to know.
We're born with all of the eggs that we're ever going to have. We're born with a finite number. We can't make new eggs and we lack repair mechanisms. So over time, our egg count and our egg quality are always going to be declining. They don't decline at a linear rate. And we tend to see a pattern where you lose eggs at a faster rate and egg quality tends to decline more rapidly as we get to our mid-30s and later. So rather than a cliff, it's more like a continuum. And something to know is that when you're in your early 20s to very early 30s, not a whole lot is changing that quickly. Of course, we're always losing eggs, and yes, the quality is declining, but it's very slow. I know I'm going to offend someone when I say this, but even in your 20s, when you're thought to be in your reproductive prime years, you still do not have perfect eggs. Nobody has perfect eggs that will make 100% perfect embryos. Even in your 20s, if I was to take all of the eggs that I could get to, if I was to do an egg retrieval and turn those eggs into embryos, I would expect about 20 to 25% of those embryos to have genetic imbalances or errors that would limit their reproductive potential, not allowing that embryo to implant or stay implanted. That's as good as it can possibly get. So it's important to remember that that's our starting point. And then if we think about at age 35, if we play through that same scenario, we see numbers more like 35% of embryos being abnormal, but 2/3 of those embryos are going to have high reproductive potential. So the odds are still in your favor. And at 37, 38, when a lot of patients will automatically assume, oh my gosh, my egg quality is so poor, what we see is more like 50-50 in terms of the proportion of embryos that will test as normal versus abnormal. And at 40, it's more like 70% of embryos will be abnormal and 30% would be normal. And yes, that is a drastic change. But remember, there's still an ability to make a normal embryo. And every month or every cycle, there's a random selection of an egg, that one lucky egg that gets selected to be the winner, that gets to ovulate. And what this data from all the embryo testing that we do is telling us is that at 38, at 40, even at 42, even at 45, we can make normal embryos, but they become few and far between, especially as we approach our mid-40s. And that's the issue, only ovulating one egg every cycle. So it's often going to take so many more ovulations to have that lucky egg be released and to have all of those things line up that need to line up. And when pregnancy does occur, there is this worry of this heightened risk that the embryo that implanted to result in that pregnancy had a much higher probability of being abnormal. And this is why there's such a high risk of pregnancy loss, miscarriage in the first trimester, especially as you get into your 40s. When we think about egg quantity, yes, that's also changing with age. We're not going to have access to as many eggs. It's going to be harder to respond. And so treatments like IVF, which can often help, especially when there's egg quality issues, because you can use things like PGT, they're not going to be as effective because we'll have less eggs to work with. I guess what I'm trying to say here is that you have every reason to feel hopeful, even if you're over the age of 35. You haven't fallen off of the fertility cliff.
It's definitely possible to get pregnant when you're older, but it's about knowing where you stand and having a realistic plan.